As you know, we had a temporary shelter put up in the Bradley Center, and one of those people that made this all possible is Polly Smith, who's the Director of Employment and Social Services, and I have her on today. Polly, thanks for joining me today.
Hi, thanks for having me, Eric.
So I got to ask you, how are you doing during this interesting time in our community, province, and the whole world for that matter?
Oh, yeah. Well, I think like most people, I'm just doing my best. I'm hanging in there, and being busy and working a lot is really helping get through these changes. But it is a challenging time, and in so many different ways, personally, professionally. But hanging in there. I'm grateful for being so busy. It really does help.
Yeah, and in a time of need right now, your team must be extremely busy. And for someone who may be living under a rock, or maybe just new to the area, let's talk about some of the important services that you and your team have provided to the municipality.
There's a lot of services that we provide, and I think a lot of people wouldn't know necessarily about all of them until you need them. You don't necessarily, you don't always hear about them. So our biggest program is Ontario Works Assistance. So we help people with applications for financial assistance. Ontario Works is what used to be called Welfare Social Assistance. So that's our largest program. Under that program is an employment program. So we work with our clients in Ontario Works, as well as individuals on ODSP in finding employment and some training programs and preparing for employment. And we've been very active and very strong in that for a number of years, with some of the highest levels of exits to employment in the province until recently. And we also have a very strong homeless prevention program that we operate, and that's funded by a different Ministry of Municipal Affairs and Housing. And we do a number of prevention programs. We run the employment resource centers, the community navigators that help people find programs. They talk, in person. They've been through the libraries. Now they're over the phone. They help people sort of navigate systems. And through the homeless prevention programs, there's quite a few different programs that help people keep their housing, find housing, pay their bills related to their housing, and making housing more affordable. So we operate a number of those as well here in Chatham-Kent.
Yeah, we could probably go on forever and ever. There are a lot of amazing services that you provide. Before and now, we didn't expect anything like COVID to hit our municipality. Right. The word homelessness hits home to a lot of people, because in CK we see this in a different way that a larger city would see it. How has your workload kind of changed before and after COVID?
Right. We've always managed emergencies. That is what we do. That is what we do for the poor and vulnerable in Chatham-Kent, or people that are sort of having a bad time, but also in a crisis. So when there's emergencies like Erie Shore Drive or other things like that, we'll be involved, even though those individuals may not have an income issue. But this is a whole different ballgame. This is such a longer, more pervasive crisis. So it had changed a lot of things. The biggest, most notable change, I think, in the community was really when all these individuals who were essentially homeless, that were staying in places, were suddenly on the streets, more visible, right? We had been seeing in recent years more and more visible homelessness, but not to this extent. Suddenly you're noticing people everywhere. Those people were always here. They are not from out of town. They were here, and we were working with them, or trying to work with them, as were numerous community partners. However, they were what we call couch surfing, or staying in maybe overcrowded conditions or places. And when this hit, suddenly a lot of those individuals found themselves sleeping rough, being more visible in the community. So knowing that people needed a place to stay that was safe and socially distanced, and worrying about people being in overcrowded situations, we looked at different options for housing more people. We had been trying to get additional hotel rooms. We use motel rooms and hotel rooms as transitional housing all the time, and hundreds of people go through there until we can get them an apartment or rental. And that's how we spend our homelessness dollars typically. But with this, there just wasn't enough room at the inn, so to speak. There was so many people that even though we increased capacity, made some new partnerships with more motels and hotels, it just wasn't enough. So that's when we knew we had to open the shelter. And of course, that's been a big undertaking. And we also figured if we have to open a shelter, we wanted to achieve our COVID goals, right? Our temporary social distancing, a place for people to be screened and tested and have wellness checks. But we also want to complete our housing and homelessness goals for the community. We want to help people to find permanent housing.
Yeah, it's the shelter's been open for a couple weeks, and the numbers are speaking for itself. So I'll ask you a little bit about that in a second. We only really had the other, not-for-profit Hope Haven that was holding it up, and then as COVID got into probably the height of it, they unfortunately closed down. So you and your team kind of got there and put this temporary shelter together. Let's talk about that project process.
So so again, we were housing, all of the people that have been that were needing housing through the shelter, or providing that as an opportunity, because it is, it's not necessarily where everybody wants to go, but that we've been open for it's 5 weeks today. It feels like about 2 weeks. It's gone really fast, but 5 weeks ago, and after 4 weeks, we'd found we had we'd seen over 85 individual unique individuals. Some would stay, some will come and go. Some have been moved to other accommodations, other transitional accommodations like motels. It all depends on the family situation, and the level of engagement of the person. So we have had some successes out of that too. The last I heard, last week, we'd had 5 placed into permanent housing, which is a really low number, but in this time, it's actually not bad. And we are working with a number of people with high needs, and they're not easy to house, right? And they're not always sure they're ready to be housed. So it's been a real learning experience. We're learning from our residents. Every week, the manager of housing and homelessness, Josh, goes in and talks to all of the residents living there and asks them, for information, advice, really, and what can we do to help you more? And we've been working very closely with community partners on all aspects of that. And we do have them coming in too and providing some services, or including mental health, addiction services, friendly visitors. Some of the people that deliver, food in the community are friends to the individuals that are staying with us. So we wanted them to be able to access those people who've been a good support to them.
Yeah, it's great that you have helped almost 85 different unique individuals, as you say, because not everyone's going to want to be proud, and ask for help. And that's kind of, this resource has been here and it's been great. Just following up, a lot of talks saying, we have this temporary shelter. Is there plans, kind of as COVID is still hitting, for a permanent shelter to take place? Or do you see this foreseeable taking the Bradley Center for, a more of a time frame?
I think we are looking for an alternative location that we could have longer term. I don't want to say a permanent shelter, because we really don't see a shelter is not a home. We would like some sort of a hub for housing, where people can go and receive services, drop in, and be connected to housing. Our hope is to find the people that we're working with long-term housing and do that. And over the next year and a half, get that number to be smaller and smaller of who is unhoused. And then provide services through the day. I mean, we're still working on different models. We've been looking at best practices across the province and the country, to be truthful. So what that's going to look like is not yet determined. But we know we need a longer term temporary shelter, and we are looking for a longer term facility.
No, that's great. It's just a good resource that's all out there. So when we're talking numbers that are fluctuating during COVID right now are obviously employment numbers. We've seen small businesses kind of, get through here via curbside pickups, or once I've unfortunately had to let certain staff members go. What have you kind of seen locally at this time as our Ontario opens up in phases?
Well, from the sort of Ontario Works perspective, we had, before the CERB benefit was in place, we had a number of people applying for assistance, for emergency assistance. And that is just a small amount of short-term funds that we're able to provide. And the province that was usually like, the province sort of tripled that amount, which is still quite low, but they tripled it. So that helped. So we were seeing in that a lot of people that I would call self-employed, sort of contractors, like maybe a hairdresser who rents a chair, or, individuals that suddenly couldn't work, but they worked for themselves, and they had, went from just getting by to nothing. And so we saw a big increase in calls. Then CERB came in and things stabilized. So the caseload has gone up, but not incredibly high. We're expecting a second round when the CERB benefit ends. Job-wise, we're still seeing jobs posted on, on the municipal website. We actually operate that. So there's community jobs that are on the website. Indeed is still posting jobs. They've definitely slowed, but it's certain types of businesses that this situation is actually creating more work for, that tend to be hiring, or that have, for example, farms have lost the ability to have some of the migrant workers, or have as many. So there are some positions that might be in farms or greenhouses or whatever. But there's a whole range of positions out there, and some jobs that just need to be filled. There's also, some people can't go to work because of childcare issues. So they need temporary help to fill in for that person. And it's just a really strange time.
Yeah,
There's a little bit of everything.
yeah, I would have to concur with that. That now that we're seeing everything kind of opening up, that there will be demand for other jobs. And from what it sounds like from your point of view, that there are still jobs available, which has been great, because you won't see that in maybe some of our larger cities. So I think we've kind of touched base on some of the difficulties you have. But has there been anything else that you and your team have been challenged with during the COVID pandemic?
I think the one thing I do worry about is the homeless population. All of these things, a lot of the problems we're seeing highlighted by this COVID pandemic are problems that were already there. And what's going to happen after. So that's what we're very worried about. We have, some extra resources now. We have some opportunities. There's some beautiful things happening, beautiful partnerships partnerships that have been reinvigorated. Chatham-Kent is a wonderful community, and we do get creative. When the going gets tough, it's true, the tough get going, and we are tough. But conversely, these problems have been ongoing. What will happen when the money is not there, or if we head into recession? Will they be forgotten? And I really hope that's not the case. I hope that there is more investment into, and not just in my world, but also into senior health and long-term care. And but we also know that a lot of our homeless problem comes from serious mental illness and addictions, and that are untreated. And what might be a better way to go upstream before someone is homeless, to resolve these issues before they happen? And will there be the money for that? I certainly hope so, because we're going to need it. But again, like I said, we have a great community of very caring community partners and municipal staff that are committed to making a difference in this.
You're segueing to what you just said earlier, beautiful partnerships. Obviously, we got to turn a negative into a positive. And around our community, we're hearing the word good news stories. There has to be some great good news stories for you and your team during this COVID. Do you have anything to share?
Good news stories. What we've seen has been really cool is there's more outreach happening. That Canadian Mental Health Association they've been great with that. We've always had a good partnership and worked with them, but they come into the shelter, they provide services. But I'm hearing from from other groups that they're also going out to where homeless people are staying out, in different places in the community to meet people and to help people. And they're finding them and offering services. There's things like that are happening that are really exciting changes, because you can't always expect people to come to you, right? You have to go to them. And we're looking at doing many of the same things.
Yeah. That's great partnership, and that's great teamwork, and that's what CK is all about. And I've been loving every little inch of teamwork that every part of our municipality has been doing. So it's great what you and your team are providing. I don't think a lot of people have been able to get through this without some of the service that's provided by our municipality. So thanks to everything that you guys are doing. Polly, is there anything else that you would like to add as we close out?
No, I guess one thing I'd just like to know that if people are facing any kind of crisis or emergency, while we're not experts in that, we do work with all the super service providers. So whether it's financial or other, just give us a call. There's someone here that can help with information. Our number is 519-351-8573, and we'll be glad to offer help. We want, if anyone's in danger of losing their apartment, their home, whatever, talk to us. We'll talk about options with you and connect you with people who can help.
That's great. I think we're getting again all together through the municipality. I think when this is all said and done, I hope that CK can have one big block party within the most safest of distances to celebrate all the hardships we've endured.
That would be great. That would be great.
Thank you so much for your time there, Polly.
Thanks, Eric. It's been fun.